transfer to the other team. So if you answer right, you will get 10 marks. If you don't answer right, you will get no marks. And rounds 2 will be a buzzer round. So for that, you need to have the EZ buzzer app. So once the question is asked, you have to press the buzzer. The team which pressing the buzzer as first one gets the chance to answer. The second team who pressed the buzzer will get the second chance, and you will get 5 marks for that if your answer is correct. After that, there won't be any other passes. And third round is pictorial and audio rounds, and fourth rounds is Damcharas. So with 4 rounds, we will conclude the quiz with the marks. So every rounds, the rapid fire round, there will be 8 questions maximum you can answer in 1 minute. So in that, each question will be given 1 mark. So if you answer as many as questions possible, you will get maximum of 10 marks, or the ability of your rapidity in answering. So if you finish 10 questions, you will get more questions, but the maximum duration is only 60 seconds. No, ma'am. Only in buzzer round there is negative marking. All other 3 rounds, 30 seconds.
Having any problem? Any question? Everything clear?
Each team will get 2 questions, right? 1 circle will finish and then we'll have another circle. So the rules of the game are in each question, you have, each team gets a question and followed by 30 seconds to answer that. So this is non-transferable. So the rules of the game are simple, and we'll start.
So team A, onset, severe, persistent, closed lock of the temporomandibular joint, pterygoid, condylar head, tympanic plate. Your time starts now. No, you have to tell the option.
Okay, sir, D.
The right answer is glenoid fossa. So you get no marks. Yeah, Dr. Bhaskar. Second question goes. Walking uphill. Right answer. Team B, right answer, gets 10 marks. Team late stage uterine cancer. Your time starts now. Team C.
D होगा ना? Diverticulitis.
Team D, all restless leg syndrome except Parkinson's disease, fibromyalgia, peripheral diabetic neuropathy, status dermatitis. Your time starts now. So the may emit from which structures? Transitional segment, neo-articulation, contralateral facet joint at the level of asymmetric neo-articulation, discogenic pain from the disc above the transition, radicular pain from the herniation of superior adjacent disc, all of the above.
Five seconds left.
E, all of the above is the right answer. Central sensitization in the pathophysiology of CRPS is A. What is that? B. No, ma'am, what is UL?
Unilateral.
Okay. Unilateral, B is GABA, C is NMDA, D is calcium, E is calcitonin. Yes, it's the right answer. Second question. The matrix of the nucleus pulposus has a high water content and proteoglycans. The annulus fibrous is more fibrous with a lower collagen content. A heavy, healthy intervertebral disc is highly supplied with blood and can readily repair the internal damages. There are mechanoreceptors throughout the annulus fibrosus and nucleus pulposus responsible for the intense pain when the disc pathology exists. The scavenger cells in the IVD signal a cascade. Yeah, you can love. Answer A. It is B. Okay? Neuropathy is true. Oxycodone is not effective in its treatment. Diabetic neuropathy can affect cranial nerves. So you're supposed to tell which is true. E. All of the above. No. Diabetic neuropathy can affect cranial nerves. Actually, it is type 2 more common.
Team D 10.
Physical examination reveals Morton's neuroma. The pain is Sorry?
No, she's.
Oh.
This is for audience. Audience.
The answer is C. It's the third and fourth. A. Acute sinusitis. B. Paralysis of the ipsilateral facial nerve. Paresthesia of ipsilateral trigeminal nerve. The maxillary division. Or D. Pulpitis of ipsilateral maxillary molar teeth. And E is E. You're correct. It's vision loss. So we already have the round. Okay.
Everything is loaded.
Okay.
The mobile is ready? Yeah.
All 4 feet mobile is ready.
Okay, so this is going to be an audio-visual round, which means you will see either a picture or a video, or you will hear an audio. Okay? And then thereafter, once you are done with listening to it or seeing, in the given picture, identify X and Y.
X. Are we talking about the axis?
I'm talking about, I asked you the question, what does the X represent and what does the Y represent? You hit the buzzer.
Time and temperature.
On
Time temperature.
Asking that question,
No.
no response from the second. Anyone pressed the second? No.
Anybody wants to attempt?
Not sure. Both also is temperature. It's the yellow, what is the
They get minus.
Second team will get +5 if they tell the answer rightly. So there is a bonus.
Okay. Do you see the
the probe.
Probe A, probe B.
And this posterior annulus. Yep. Uh-huh. Mm-hmm. Yeah. Mm-hmm. Yes.
This is a video. Look at the video carefully. You have to identify the procedure and the level at which this procedure is being done.
Team B.
Cervical facet? What? Okay, I'll give it to you. This is a lesioning being done for cervical facet. This is an RF. And could you tell me the level at which it was being done? There was a lateral view. If you answer half the question, you'll get half the points.
We are okay with half.
Yeah, we'll give you half. Sorry? I'll play this again and show them.
You want to pass it there, no?
I'll give you anyways answer the marks only for one.
Guru sir, good morning.
Yes, you can answer. Yes.
3 and okay, so team B gets 5
Half
marks.
half the points.
Half the marks.
Identify what is the procedure that the operator is talking about.
This patient has pain coming down all the way from the pelvis to the toes. I would really want to enter my needle somewhere around L1 and L2 and check for the neural circuit, how it's functioning around T6 to T8 core level. And the patient should be informed that every possibility was tried and the result dictates the next step, which would be permanency.
Involved and a certain which level to go for the sensation.
What is that stage called?
What is that stage called?
There are two phases when you place a spinal cord, how you do the procedure.
I know the next phase is implantation.
Yes.
The initial phase is the trial or
Trial phase, yes. I'll give you that answer. So they get full marks.
They get full marks. Again, team D.
Team D.
Either this is a sacralization or there is a loss. To be very sure, you need to get the full X-ray scan, but I will go for sacralization.
Do you see something at the...
Next team will get that.
Is there any other team?
Yeah. Team B has responded second. Do you want to go? So they get -5. Identify the pathology and then press the bus. Press the buzzer.
Hello? Yes. There is diffuse loss of disc hydration with L4, L5 disc protrusion causing bilateral foraminal narrowing more at the left side.
Okay, team A gets the opportunity to answer. It's a wrong answer. Sorry.
Okay, if you look at the sagittal section, continuing with the facet.
Yes.
So, anybody wants to, you again remove it, you can see.
So,
having severe pain in the right hand with tingling and reduced motor grip. Patient wakes up due to pain in the middle of the night. It's excruciating. Identify the procedure and what is your probable diagnosis?
team D. Team D.
Why?
Sorry. Yeah.
How come they
Then you give me a
I told team D, but easy question being wasted.
Coagulopathy, if you have posterior column damage as well, and infection, active infection.
Don't tell me those four.
Huh?
I'm not taking those four.
I warned
Local
madam
site
already.
infection, systemic infection, and patient refusal is not expected. Give me a proper contraindication.
Exactly to this procedure.
One you told me is correct. And pedicle is damaged, what can you do?
Extrapedicular.
You can still do it,
Yes.
yeah. So that's not a contraindication again. Would you do it in a blastic lesion?
Sorry, come on.
Would you do it in a blastic lesion?
No, malignancy, sorry. Yeah.
In a lytic lesion you would, but
Yeah.
not in a blastic, right?
So we'll give half marks.
Half the marks, yeah.
So team D.
To prevent any CSF loss, now connect the catheter to the connector port after checking free flow of CSF on the device side. Once connected, you may hear a click sound. The device is then placed in a previously made gutter.
Team B. Spastic paralysis.
Okay, that is one. Second? Right. Okay, so you get full points for this.
10. Yeah.
There are two pathologies on this MRI.
You have to tell both.
Yeah.
Team C.
Intensity linear in the upper part of the spinal cord at the cervical level. This first pathology.
What is the pathology? You're telling me about the intensities. What is your diagnosis?
But they are differential diagnoses, not just one diagnosis.
Correct. So you don't tell me about the hypointensity and hyperintensity. You
Okay.
tell me what exactly is it going to be. Or
Like,
tell
for
me at least
example-
what relatively it is going to be.
So one of the differential diagnoses is infarction, spinal cord infarction. Second is the transverse myelitis.
Spinal cord infarction.
All of you.
Myelitis.
It is hypersignal intensity, the T2 weighted image at the spinal cord at the cervical level.
So what are our scores at the end of this?
Uh, 10. Team B leading with points of 35 points. Team C 10 and Team D at 15.
Time starts now.
If symptoms persist after appropriate conservative management of acute cervical disc herniation, the next step is to perform a...
Pass.
The chronic pain was transmitted via which fibers? Intense whiteness of fingers with subsequent blue discoloration with coldness and red coloration on rewarming is most likely due to?
Reynolds phenomena.
Correct.
3 indications for lumbar epidural steroid injection. 3 indications for lumbar epidural steroid injection.
Lumbar PIBD,
Okay?
lumbar radiculopathy,
They're both the same.
canal stenosis.
Canal stenosis. Again, it's almost same. 2. The first and second is almost same. Okay. Anatomy of the superior hypogastric plexus.
L5.
L5.
Situation.
Situation. Yeah.
Okay. L5S1.
Anterior, posterior,
Okay, anterior.
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 Okay, we'll give them that one. So,
So 3.
okay.
They get
Please let me interrupt. Of the one of the
Brachial plexus is formed by which rami?
C5 to T1.
Anterior
C5 to T1.
C5 to T1.
Lateral femoral cutaneous block is indicated for which of the conditions?
Meralgia paresthetica.
right.
Lesser splanchnic nerve is formed by which of the sympathetic nerves? Lesser splanchnic nerve.
T.
10, 11.
Pass.
Pain caused by stimuli that are usually not painful are defined as?
Allodynia.
Right.
Block used to treat visceral pain for malignant origin.
Celiac plexus block.
3 symptoms of epidural abscess.
Pain, warmth, and tenderness. Fever.
2. 3 indications for spinal cord stimulator.
Diabetic neuropathy. Feldback syndrome. Surgery syndrome. And
Tell me 3 complications. Are we ready? Okay. Tell me 3 complications of stellate ganglion block. Stellate ganglion block, 3 complications.
Pass.
Trigeminal ganglion located in the anterior cranial fossa, true or false?
False.
Correct.
Opening pressure in lumbar discography is appearance of contrast in the nucleus, true or false?
Pass.
2 indications and complications of percutaneous vertebroplasty.
Embolism, thromboembolism, and nerve indication. Vertebral fracture. Vertebral fracture, anterior column fracture of the vertebra.
Anterior
You said
column.
complication.
There's indication also and complication also. Tell me 1 complication, 1 indication.
Embolism and fracture, vertebral body fracture, anterior part of the vertebral body fracture.
Okay. McGill Pain Questionnaire is a single dimension pain scale, true or false?
Pass.
Mostly occur in females.
False.
Correct.
Enhanced sensation and pain from sites remote from the site of injury is called?
Refer pain.
False.
There are trigger points in myofascial pain syndrome and tender points in fibromyalgia. True or false?
True.
Correct.
Abortive therapy for cluster headaches.
True. Oh, about
You have to tell the abortive therapy.
NSAID, paracetamol, oxygen, breast.
High flow oxygen.
Yes. Correct.
3 side effects of opioids.
Respiratory depression,
Urinary retention,
ileus,
nausea, vomiting.
Okay. Radicular pain is considered normal part of pregnancy.
normal.
Radicular pain is considered normal part of pregnancy.
False.
Correct.
Transdermal medications should be applied to the area of pain. True or false?
False.
Correct.
Does stellate ganglion block work for post-traumatic stress disorder? True or false?
False.
True. Wrong.
6.
Tell the aggregate. Till now, which team is where?
Aggregate or have 6 points and their total is 41 and they are leading. Team C got this in this round 2 points and they are tying up with Team A 12 points. Team D this round they have got 6 points and their second leading 21 points.
This is dumb charades. Okay? Each team in scenario, you have to enact and your team members have to guess the correct answer. I request.
No talking. Audience won't be able to enact because they don't know.
But still, they may.
No mic.
No, for the answer.
Cervical and
You can prompt.
canal stenosis, cervical and lumbar both. One answer. Okay. Lumbar canal stenosis.
Is it correct? No.
No, you just.
Old age, back pain, fall, compression fracture, vertebral fracture, after vertebral fracture. headache, post, old fracture, vertebral fracture is there. Okay. After that, fall, history of fall, traumatic fracture, osteoporosis, traumatic fracture, traumatic compression fracture, okay. Headache. कोई बोल रहा है क्या?
Distraction.
Balance, anger, migraine. Over.
Radiculopathy.
Loss of sensory function. Sensory. Loss of sensory function.
Fibromyalgia.
Sensory.
Needle pricking. Needle. Dermatomes. Myotomes, dermatomes.
Hyperalgia.
EMG, NCV, that.
Hyperalgia, sensitive.
Hyperalgesia. Herpes zoster. Post-herpetic neuralgia.
Very good.
Cluster headache.
That was very fast.
He just took 2 head.
Pharyngeal neuralgia. Glossopharyngeal neuralgia.
That was fast.
That was glossopharyngeal neuralgia.
Next.
Come. No.
वो फेंक दो.
You have to give.
Tenosynovitis.
I think she told and came.
Walking. And sitting. Pain on walking and sitting. Pain and on walking and sacroiliitis.
CRPS.
Points. So score at the end of.
Burning pain, radiculopathy, ankylosing spondylosis,
Facet joint syndrome. Ankylosing spondylitis.
For round 4, Team A 10 marks, Team B 15 marks, Team C 20 marks, Team D 20 marks. And final score for position number 4, Team A, position number with 22 marks. Position number 2, position number 3, Team C with 32 marks. Position number 2, Team D with 41 marks.
And the winner.
Position number Team D.
You can call them on stage.
Team C
Yeah.
and Team D also.
I think we can.
Yes, we can have good group photo.